Hi, everyone. It's Dr. Azi here. Welcome to the More Than a Pretty Face podcast. Hi, everyone. I'm Dr. Azi, a board-certified dermatologist and the host of More Than a Pretty Face podcast. And I'm here today with my incredible co-host, Nurse Lacie.
Hi, everyone.
Hi, how are you?
I'm good. How are you?
Good. What, you're like glowing. Are you about to go on vacation or something? What's going on?
You know, it's almost summertime. It's getting warm out.
I know.
It's giving all this vacation vibes and I'm loving it.
It's finally sunny in Southern California. We went through like Seattle weather for the past 6 months.
It was horrible. And you know, it's funny you asked if I'm going on vacation because I get this frantic call during our busy day on Friday, and it's my dad, and he's like, "Hey, really good deal. We're gonna go to Germany.
Oh,
I invited your sister, her husband. You guys coming? We're gonna fly to Germany. We're gonna do a boat cruise or a river cruise. And I need to know." And I'm like, "I'm working. Figure it out. Tell me the details.
Yeah.
And then text me. You know, like, come on. I thought this was an emergency."
So like retired people.
Now I'm all excited that we're going to do this family trip to Germany.
Fun.
He texts me, "Sorry, they don't accept kids.
Oh,
You can't go."
Well,
Ew.
Yeah.
I told
that's
him,
a problem.
I said, "You need to find a new family vacation. We're not doing this one then."
That's weird. They don't like take kids.
16 and older.
Oh, it's like an adult thing.
Rude.
How rude.
So now I'm going to have FOMO because they're going without me. So rude.
Well, do you have a beauty at least?
Yeah, I do. Well, I'm super excited because it's Melanoma Awareness Month, and we are going to be local sponsors for the Melanoma Walk.
Yes, I'm so excited about this. It is coming up May 20th. We are going to be at the Melanoma Walk because it is one of our most important activities in terms of raising skin cancer awareness. We see so much skin cancer in Southern California, and I'm so excited for the event.
I am too. I would say my blemish ties into this month because, as you know, as my doctor, I have millions and millions of moles, and most of them are abnormal.
Yes, you have a lot of abnormal moles.
Yeah, it's my lifestyle when I was younger, but it's fine. We did a DermTech, a sticker testing, and it came back abnormal.
Oh,
so now I have to put myself on the schedule for a surgery.
Oh, well, for those of you guys that may not know what DermTech is, it is a sticker that analyzes the PCR of moles and looks at the sequence to see, hey, is this suspicious for melanoma or is this a normal mole? What's nice about it is there's no cutting involved. It's literally just taking a sticker and putting it on the mole and sending it to the company that runs the sequence. And it tells us, should we biopsy this mole or is this mole okay?
Yeah.
So I love it for people who have a lot of abnormal moles because I don't want to be just giving them all kinds of scars and cutting on all their moles all the time. So it's a great tool that your dermatologist can use to determine if this is a mole we should be worried about or one that we can get a little bit more reassurance for.
I know. I'm so thankful for the sticker tests because it saves my skin.
Well, my beauty is that I took my teenage daughter and two of her friends on a little getaway to Laguna Beach, and the weather was absolutely perfect. It was finally summer, and we went to the beach, and my blemish is, oh my God, you're not going to believe what they were doing.
No, tell me. I have to know.
So all over TikTok, I don't know if you've seen this, but people are taking Aquaphor and putting it on their lips and going out in the sun because these teen TikTokers are getting a lip plumping effect from it.
No.
So
it's
these girls, of course, I'm wondering why my daughter's always asking me for Aquaphor. She's like obsessed with it. She puts it on her lashes. She puts it on her lips. So they're out there with Aquaphor on their lips, laying out. I'm going, whoa, what is going on? So I had to give them a lecture about this.
Yes.
So guys, Aquaphor, or actually any type of shiny lip balm, whether it's a lip gloss or Aquaphor, Vaseline, whatever, what that does is it magnifies the UV rays and concentrates it onto a small focus, that being your lips.
Yes.
Now, your lips are also very thin, so they get damaged much more quickly than skin elsewhere. So not only are you putting this on, it's like going out and laying out with baby oil. It's going to accelerate the sun damage and make a sunburn on your lips much more likely and much faster than if you had on, for example, lipstick, which is matte and has a color. That's actually protective. In fact, some studies show that because women that wear lipstick block off as a physical blocker some UV rays, that tend to have less skin cancer than men who, for example, don't wear lip balms at all.
Yeah, because you can get skin cancer on your lips.
We see it all the time, guys. I have treated a 19-year-old with a squamous cell skin cancer on her lip. So don't take this lightly. Do not put Aquaphor on for a lip plumping effect. That lip plumping effect that you're seeing is actually inflammation from sun damage.
Yes.
Where your lips are swollen, they're red. It is not a plumping effect, okay? It's best to use a gloss. Now, Aquaphor does have a lip balm with SPF in it. And if you want to look for an SPF 30 or higher, and you want to reapply it every 2 hours. So if you're going to use Aquaphor in the sun, be sure that it has SPF in it.
I'll tell you, I have in every purse, in every beach bag, AZMD lip plumper because it has SPF in it and it gives you a plumping effect. It makes your lips a little pink, it adds color. It's my favorite. I've gotten all of my friends on it. Everyone around me knows you do not go out with lip gloss unless there's sunscreen. So important.
Yeah, the Pout Plump 30 has SPF 30 in it and it has a plumping effect. That's going to be my gift to my daughter and her friends. So they stop doing the silliness they're picking up on TikTok.
I love that.
Well, which brings me, I'm so excited about the new launch of our UV Defense Spray. It's an SPF 50. And what I love about it, it's mineral based because I see so many of these chemical sunscreens that people are literally drenching their bodies. And although chemical sunscreen, I'm not saying that it's going to kill you or, you know, is harmful. It's still better than not wearing sunscreen. But I just feel better about putting chemical-free, mineral-based physical blocker on the skin. And this one is reef safe. It is mineral based with zinc and titanium. And this thing does not come off. I've been testing it the past couple of months. And I swear I put it on and it's still on like 6 hours later.
Do you think that it means it's still effective?
Well, I still think you should be careful and reapply every 2 hours if you're in the sun. But it really sticks to the skin and is not coming off. In the shower, I have to be like, because it is zinc and titanium. It's a physical blocker.
I love that.
And I just think it's safer than those chemical ones. So I love it for like the arms, the legs. You know, you can use it on the face. I personally prefer powders or lotion for the face, but hard to reach areas.
Yeah, totally. Are we going to bring it with us to the Melanoma Walk?
Yes,
guys,
we should totally do that.
May 20th, Liberty Station.
Come out to Liberty Station, say hello. We're going to have a booth there. We're going to have the UV defense there. But I'm so excited to give it away to 3 lucky winners for the launch. So guys, you'll have to go to our Instagram today and enter to win. 3 lucky winners will get a UV defense spray. And we're going to announce the winner on Friday. So stay tuned for that. But
make sure you comment.
And you never know. You make sure you comment. You might get a little surprise. Even if you don't win the UV defense, you might get a little surprise from us in the DMs. So check it out. Wednesday, May 17th, which is today.
I love
the
it.
Post.
All right. You know what time it is. Ask Dr. Azi.
Yay. I love hearing from you guys and your questions.
Yes. You guys, if you have any questions, we love to hear from you. Make sure you DM us at More Than a Pretty Face Podcast or Skin by Dr. Azi. And you can also email us your questions at morethanaprettyfacepodcast@gmail.com. All right, let's get started. Our first question is from Eddie. She says, "Hi, I'm a big fan. I'm curious to know if you've ever covered the issue of makeup pilling due to mineral sunscreen. This is happening to me now, yet I haven't changed any sunscreen. What are your tips?"
Okay, you said pilling.
Yeah.
Is that the same thing as piling?
Well,
does that mean like it just piles on?
No, pilling, I learned from our esthetician, is actually like a pill that you take, oral pill, but it's pilling. And I always thought I misheard how you pronounce it, but it's like when you put your makeup on, you get like this peeling is how I always thought it was called. It's like of your product. It almost is like you have dry, flaky skin, but it's the product pilling.
So that is a great question. It really depends on the sunscreen formulation. So for me, the way I look at it is like the daily elegant formula of sunscreen that you put on under your makeup. And actually it helps almost serve as a primer to your makeup. And then there is the chalky, like, the kind of sunscreen you put on when you're going to go running and you're not going to wear makeup.
Yeah.
So I like to differentiate between those two types of sunscreens. Ideally, you want to get a moisturizer that has sunscreen in it because moisturizing the skin, hydrating it before you put your makeup on is actually going to make your makeup look less cakey. So some of my favorite sunscreens would be, I love Elta MD.
Yes.
They make one called UV Clear or a daily one, and it has hyaluronic acid in it, and it is a zinc based, but it just goes on so smooth and hydrates your skin. I also love the Hydra Tint BB SPF 44. Now that is a tinted one, and that is my personal favorite. It has glycerin and hyaluronic acid, and really it makes your skin look so dewy and glowy, and it allows the makeup to just grab right onto it. So I find it to be a great primer with sunscreen if you're going to put makeup on top of it. Now, I personally, I have it on today. I don't have foundation on.
Me too.
I only wear the Hydra Tint because it is water-based and not oil-based like a lot of foundations. And I find that it gives me enough coverage with a little bit of powder on top, like loose powder. I feel like that's all I really need. But if you're looking for a heavier makeup look, then using a moisturizer with SPF as opposed to an actual sunscreen.
Kentucky.
Now, other ones would be, Kentucky. All right. All right, this is an inside joke, okay? I'm going to fill you guys in. So Kentucky is a code word when I start rambling on and talking too much. It's actually a code word that we use in the office when I'm being too honest with a patient because Lacie thinks sometimes I'm too honest and it hurts their feelings.
This time I use the code word because she wants to know if she's not changed anything in her skincare routine and then she starts pilling, what could be the cause?
So you're telling me I missed the question completely?
Okay. But I love the feedback you gave because those two sunscreens are my favorite too.
So all of a sudden she's, So in that case, I'm sorry, we're going to back up a little bit. So in that case, you might be over exfoliating, your skin barrier might be disrupted because if you are pilling, which means your skin is flaking, that's usually a sign for irritation. Your skin is not quite happy with you. So my suggestion would be cut out your actives for a week, maybe 2 weeks. Try applying a hyaluronic acid to damp skin. You can always mist the skin, apply hyaluronic acid, and then apply a heavier moisturizer on top. Skip your actives and do that for a week and see if you can get your skin restored and reset.
I love that.
All right.
I personally do the La Roche-Posay before I put on any products.
The spray, the thermal spray. I love that one too. Avene makes one too, but I do like the La Roche-Posay.
Yeah, it's my favorite. Okay, second question was emailed to us. Hi, Dr. Shirazi. My husband was diagnosed with melanoma on his left cheek and will be having surgery to remove the cancer coming up here shortly. It shocked our family quite a bit, and I want to be as supportive as possible. Can you give me some after-surgery care tips for him? He's quite afraid of the scarring, as he's a pilot and wants to look as professional as possible in uniform. Any tips are welcome. Thank you.
Yeah, it's interesting because there was an article in JAMA Dermatology that noted the incidence of melanoma in pilots is twice as much as the normal population. So you are more likely to get more UV exposure when you're up in the air. The atmosphere is thinner. So as you move away from the Earth's grounds, you're going to get more exposure to UV rays. And with pilots, because they sit in that cockpit where they have that windshield and it doesn't block out UVA rays, and you are going to get a lot of UVA rays with those windshields and up in the air than you would just as an average person that spends more time on Earth, like on the ground. And those UVA rays go through the windshield and can do a lot of damage to the skin. So important to reapply when you're out there. If you can, where the pilots have the cap, that shade at least will give you some more protection. And then be cautious of your eyes. You can get melanoma in the eyes. And that was one of the things the study looked at, is the amount of damage, UV damage to the eyes, the eyelid skin is much, much greater. This area is more delicate and thinner, as well as the lips as well.
So, it's amazing that so many, normal people just wouldn't think of that. High elevations or being maybe a pilot and it's cloudy days or whatnot, you're still getting all of those rays.
The UVA rays are out. And even though the shield can help with some of the UVB, it's the UVA. So it's like going to a tanning bed basically for hours and hours and hours.
Now, with the surgery, when you do a surgery excision for melanoma versus a basal cell or squamous cell, what is the difference as far as your expectations as a patient?
Right. Yeah, it can be really scary for people to get diagnosed with melanoma because it's the third most common type of skin cancer, and it can be the most deadly because it loves to go the bloodstream, and we are seeing more melanoma now than we've ever seen before. And if you don't catch it when it's in the skin, it could potentially get into the bloodstream and spread throughout the body. So it's important to catch it, remove it. Now, the good news is the face heals the best. I think just evolutionary wise, it has the most stem cells, it heals the best, has the most pores. So that's good. So some of my recommendations would be, one, to start wearing a silicone gel product or silicone gel sheets at about 7 to 10 days after your procedure. And then you want to treat the scar early. So previous studies, we thought that we would wait 2 or 3 months and then treat the scar after surgery. But recent studies are showing that if you treat scars as early as 1 to 2 weeks, actually does better. The scars are remodeled and they smooth out and look better if you intervene early. So talk to your dermatologist about doing a laser treatment like the V-beam laser or resurfacing treatment to help with that. And then lastly, make sure you protect it from the sun. It's so important. And honestly, if I was a pilot, I would cover it. Being up, that's the best way. You put sunscreen on, but sunscreen is not going to block out all the UV rays. It's going to reduce the UV exposure. But if you're out there and you have a fresh scar, cover it so you're not getting direct sun on it.
And explain to them why that's so important, avoiding sun exposure to a new scar.
Yeah, so that sun UV rays degrades collagen. So essentially, as the scar is healing and your collagen is coming in to replace and remodel, it's going to interfere with that healing aspect. So it's going to delay healing. It's also going to make it more likely to discolor the scar. So the scar might remain red for longer periods of time, might become more noticeable. It might turn brown. So sun is definitely your worst enemy when it comes to trying to heal the scar, giving it its best shot.
Yes. I love that. Great feedback. So I thought it would be fun, since we're talking all things melanoma and it's Melanoma Awareness Month. I think it'd be fun for you to hit us with 5 fast facts about melanoma. Ready? Go.
Love it. Okay, I'm ready. So the most common place for melanoma in men is the back, and the most common place for melanoma in women is the back of the leg.
That's interesting.
Yes, that's number 1. Number 2, you can get melanoma where the sun does not shine.
This is true.
And that means the bottom of your foot your toenail. In fact, Bob Marley died from a melanoma on his toe. He thought it was a bruise from playing soccer, but it turns out he declined a biopsy until it was too late. It spread to his lungs, his brain, and that was tragic.
Yes.
Okay.
That's your favorite story. I hear it all the time to all the patients. I love that story.
I make people check their toenails because they come in with nail polish, and I tell them, remove your toenail polish, check your nails. You can get melanoma in the nail.
Yes.
Number 3, melanoma can be colorless. We think of melanoma as a dark spot that's black, but we see melanoma that's white, that's colorless, that looks like it could be nothing. Number 4, melanoma usually comes up as a new spot. So if you've had a mole you've had your whole life, it's much less likely for you to develop a melanoma in that than getting a brand new spot that comes up as a melanoma. So I tell people you can get new moles that are made up of melanocytes up until you're about 40. After 40, if you're getting a new mole, pay attention to it. Do self-skin exams every time you get out of the shower. Even if you don't know what you're looking for, just looking at your skin so your eyes get used to what you have. So if there's a new spot, you can catch it.
So true. And
number 5, melanoma is the fastest growing skin cancer in the US, which means that we are getting a lot more sun that is causing a lot of damage, and we're getting really good at detecting melanomas.
You know, what's interesting to me is that we are seeing so much more melanoma now, when I feel like as a society, we're much more knowledgeable with sunscreen protection and how important it is to protect yourself. So it's interesting to me that with all of this knowledge out there, that we're still seeing more.
Well, I think what it is a lot of the sun exposure happens when you're younger.
Right.
I was listening to my daughter, and her friends this weekend, and they were talking about going out and getting a tan, but they were really good about putting on sunscreen. And actually, my daughter's like, I think we need to reapply. Like it was like a little bit,
good.
So they are becoming more aware of it. Even though they are tanning, they're still putting on sunscreen so they don't burn at least. But
wow. Well, thank you, Dr. Azi. Thank you to our community for listening and submitting questions. We're here for you. We love to hear from you. DM us anytime at More Than a Pretty Face podcast.
Yes, we are so grateful for your subscriptionship and your listenership. Let us know if you have any questions. We'd love to answer it on the show.
Till next time.
All right, guys. Bye.
Bye.